Hi, I'm Nancy Clark.
And I'm Anne-Marie Wallace-Phillips.
We're the Hospice and Bereavement Coordinators with VON Oxford, and this is Morning Chats with Anne-Marie and Nancy. Cheers, Anne-Marie.
Cheers, Nancy. Welcome to another edition of Morning Chats with Anne-Marie and Nancy. Today we have a very special guest with us, Laura Poirier. Laura Poirier is a volunteer extraordinaire with the VON Oxford and Sakura House. Laura volunteers as a personal care assistant, which is a PCA at Sakura House. She also is a hospice volunteer out in the community, and also is one of our bereavement volunteers. So we are so pleased today to hear Laura's experience of what it's like to be a hospice and bereavement volunteer with VON. So welcome, Laura. It's good to see you.
Thanks. Hi, Anne-Marie. Hi, Nancy.
Hi, Laura.
Laura, can you share with us what drew you to become a hospice volunteer?
Right, sure. It's a bit of a funny, interesting journey. I was actually fascinated watching the house be built when it was a private residence, thinking what a cool place it would be. And a couple of years after that, I was at church, and our church was encouraging us to get involved in some serving or volunteering in the community. And they actually had a speaker from VON come in and talk to us about the possibility of volunteering as a hospice worker. And I was kind of intrigued, so started looking into that and started the process actually. And that was kind of sidelined by a family health crisis that we had. I wasn't actually able to move forward with the volunteering at that time. And as it turns out, we ended up being in Sakura House receiving hospice care. And that's what kind of clinched it for me, having experienced receiving the care, realizing what a valuable service it is, and then realizing that it's something that I would like to do as well.
Wonderful.
Great. Thank you for sharing that.
Absolutely. And Laura, we were also wondering, from your perspective, what value can a volunteer bring to someone's end-of-life experience?
Right. Lots. I think I've had the opportunity now to work both in Sakura House at more end-of-life care and in the community as well with an individual who wasn't quite yet ready for residential hospice care, if that's what you would call it. In the early stages of hospice care, I was able to do some work that seemed overwhelming to the person needing the care. We did some photo sorting, so maybe legacy work, things that were physically hard, but things that were important to the person to have finished before they actually came to end of life. Sorting, organizing. We sorted hundreds and hundreds of photos so that albums could be put together for kids. Spending time with someone who knows that they're coming to the end of their life. I think just being a pair of unbiased listening ears, someone who isn't involved on an emotional level, that can just kind of listen and comfort. Later getting on to maybe physical comforts, things like repositioning if somebody's uncomfortable, or hand rubs, foot rubs, things that don't need medical training, painting toenails and fingernails, to try and just bring some joy into a life, playing cards, reading to someone, just I think being someone that is there and someone that cares.
Yeah. Absolutely. And Laura, you actually, your comments and your feedback have absolutely impacted the lives of patients and families, and leads us to our next question. How is the support of a hospice volunteer helpful for families?
Yeah. For me as the receiver of it, it was just because I think a lot of family members become caregivers in end of life situations, and that can be exhausting, emotionally exhausting and physically exhausting. So to have someone step in who is fresh and not emotionally connected to just provide some relief in physical care and freeing up family members to just be a family member and not have to be a caregiver at the same time, to kind of allow a husband to be a husband, or a child to be a child, and not feel that they have to carry the physical and the emotional load of being caregiver as well. That's what I found really helpful, to give them a break from care. Sometimes people just need to be able to step away. And I helped in a situation where a child was caring for a parent and just needed an hour here and there, just needed to be able to step out of the home and take a breather. So a volunteer is somebody that can step in and do that. And I think that we also, as a volunteer, might be able to connect family members to resources if we see them really struggling in an area, and have an idea as to a resource that might help. That can be done as well. And I even had the honor, I would say, of providing hospice care and then being able to work with a surviving family member in bereavement support as well.
I'm so glad you mentioned that, Laura, because that is such a beautiful part of what our team can do and our amazing volunteers can do is, meet families through that whole continuum for them, from before the death, through the death, and then supporting families afterwards. It's such an amazing element. So thanks for sharing that. And our last question for you is, how has becoming a hospice volunteer impacted your life?
Yeah. I actually consider it such a blessing. First of all, to be able to work alongside some amazing staff people, watching them care for people in end of life. It gives me a chance to meet super people like you guys and the nursing staff and everybody else involved in that. I consider it actually quite a privilege to be invited into that journey with families, to share those tough moments and highly emotional times. I've been motivated, I've been encouraged, and I've been humbled by experiences that I've seen. And I think that in my own life now, I'm valuing relationships differently, recognizing that we're all going to move into end of life, and just understanding the importance of relationships with people around me. And we're openly able to talk about death and dying now that I spend the time doing that. And I think that kind of helps too. It helps us all get ready for that.
Well, thank you so much, Laura. As Anne-Marie had mentioned earlier, you are just an absolute star. You're an amazing element of our team. And we really wanted to showcase on these morning chats a volunteer in action, because we can talk about it, explain our process, explain how we help. But seeing someone like you who's done it all and has such heart and passion, I think it really speaks to the level of support that we can provide people, and our volunteers especially. So thank you.
Thanking you guys for letting me do this. I love it.
Good. And Laura, I also think you, along with a couple of other volunteers that we have, it's beautiful to see you able to support an individual while they're palliative, and then when they're at end of life, and then continue with the family to provide bereavement support. Because as we know with palliative care, the bereavement piece is a huge piece for the families, and it's just so wonderful, and it's just so warm to see this continued support available, and you do it so beautifully.
It's great for me too, because I wonder how the families are doing
Yeah.
after they lose someone. So it's really nice for me to have a little bit of a connection after and see how people are doing and be part of that as well.
Right.
Yeah.
Good. Thank you.
Okay.
Thank you. And for more information, reach out to Anne-Marie and I by phone or email. Visit vo1oxford.ca for our different programs and services. And be sure to follow us on YouTube and subscribe to our channel for more of our morning chat videos. Take care.
Thank you.
See you.